Again, for being here. I will go ahead and call the meeting to order at 3:03. If you would please introduce yourself in the chat if you've not done so already, with your name, organization, and potential subcommittee to be counted. For attendance in this meeting today, you do need to put your name in the chat, just helping out our note takers. Thank you for those who are doing that. So with that being said, one more time, name in the chat, and we will go forward. So we're going to go ahead and just do, we just did welcomes virtually as we continue to have people come into the meeting. We're going to first jump into our consent agenda, looking at then moving forward with a point in time reviews. For many, this may be the first time you're seeing these numbers and getting that information out into your hands. So make sure you're taking notes. Also, I believe we can send out a copy of this after the meeting I don't think we were able to get one out before. Or did we all get it just before the meeting, Victoria?
We don't have the copy. Okay. We don't have the copy of the report to share, but that will be posted on the website by Friday.
Okay, so the final 2024 report will be posted online by Friday. Everybody write that down. So we'll be able to go to the website on Friday and get the full report. But with that, we'll go into the consent agenda.
Sorry, everybody. I don't have a slide for the consent agenda, but the consent agenda are the minutes and the attendance from the August 6th meeting.
Does anyone have any feedback or want to make a motion for the minutes?
I'll make a motion to approve.
Thank you, Dama. Dama Kelly makes the motion to approve. Can I get a second?
I'll second Arrow.
Arrow Woodard. Thank you. All in favor?
Aye.
Aye. I'm going to say everyone, and then any opposed? Now's your time to speak up. Okay, the meeting minutes, consent agenda passes unanimously. Thank you. Now we're going to jump into the point in time 2024 data.
Thank you, everybody, for that. And just again, in case you missed it the first time, please make sure that you put your name, organization, and subcommittee preference in the chat. And then let's go ahead and jump into the 2024 point in time data. So of course, the 2024 PIT took place in January of this year. And we counted between the point in time count, which is the survey that we and our volunteers go out and do, and the housing inventory count, which is the sheltered count done through the Homeless Management Information System, or HMIS. Between those two counts, 2,110 people in total were identified as experiencing homelessness on the night of the 2024 point in time count. Now, please keep in mind when we talk about these numbers, it's really a minimum of 2,110 people that we know of experiencing homelessness in our community on a given night. This is, of course, despite our very, very best efforts, I'm not sure that we will ever successfully survey every single person in Pinellas County. That's a great goal to have, but realistically, it's just good to know that we don't talk to every single person. So these numbers here are the minimum that we are aware of. So again, that was 721 people surveyed during the point in time count identified as experiencing unsheltered homelessness. 1,389 people were identified through the housing inventory count as experiencing sheltered homelessness. And this is a total of a minimum of 2,110 people experiencing homelessness in our community on a given night. The jail count and Pinellas County school counts were also taken into account for this report. However, that information is not reported to HUD because the standards are different and the way that people are counted is different. So in Pinellas County jails, and this methodology has changed since last year. So I'm excited to say that our data from Pinellas County jails this year and in years moving forward is better quality data. So 152 people were identified as experiencing homelessness or lacking a permanent address when they were booked into Pinellas County jails on the night of the pit count. Additionally, in Pinellas County schools, and this is going to be August through January, Pinellas County schools identified 3,555 students as experiencing homelessness. Now, please know that Pinellas County school data is different than, for instance, HMIS data. Pinellas County schools have a running list of students experiencing homelessness, and this includes couch surfing, which of course, if you are really into data regularly, you know that HUD does not consider couch surfing as literal homelessness. It is, of course, really important information for us as a community because we need to know who is at risk of experiencing that literal homelessness as well. But so Pinellas County student data, once students go on that list, they don't necessarily come off of it. Additionally, these are just the students identified in Pinellas County public schools. This does not include their families, and this does not include students in, for instance, private school or charter schools that might be experiencing homelessness. These are a few of the maps created by our digital survey. Because we have been doing the digital survey for a few years now, we are able to create these heat maps that show where people experiencing homelessness are really congregating most. So you can see here, there are 3 maps up on the screen: frequent area of stay, survey location by zip code, and then of course the heat map of where surveys were completed. The frequent area of stay, that is where people identify that they spend most of their time, not necessarily where they were surveyed. Maybe I was surveyed in Clearwater because I had a doctor's appointment in Clearwater that day, but most of the time I'm in St. Pete. That is one of the questions on the survey that we've asked year over year. So that is the frequent area of stay, is the area where people are most often. And of course, that is self-reported, as is all data on the pit count. The survey location by zip code, those are going to be the area where the survey was actually completed. So if I did the survey in Clearwater, but say I spend most of my time in St. Pete, that survey location by zip code will be that Clearwater area where we were surveyed. And of course, that will also be what shows up on this heat map here. And on the heat map, you can see the darker areas are the areas where more surveys were completed. I'm sorry, not necessarily darker areas. Those bright white areas, actually the exact opposite. Those bright white areas are the areas where the most surveys were completed. And then the lighter purple areas are where fewer surveys were completed. And there is a living map as well that everybody will be able to see. I'm going to give you a couple of the slides that were shared with the COC Board of Directors. There is a much more in-depth slideshow available as well. And the pit report itself is, I want to say, around 140 pages. So there are plenty of graphs and everything in there as well. And I hope to say most data, all data that you should want to see in the pit report is accessible in that report. And if not, please let us know so that we can try and include it next year. But so you'll see here, Pinellas pit data for 2024. This is going to be race broken down in all households on the left-hand side. You can see that the majority of people identified through the pit count identified as white. That is 58%. 32% of people identified through the pit count identified as Black, and 10% identified as another category of race. You can also see the gender for all households here. 67% of people identified through the pit count identify as male, 32% identify as female, and 1% identify as a gender other than strictly male or female. And then over on the right, you can see the age in the 2024 survey. This is going to be the age of all households. So the vast majority of people experiencing homelessness in Pinellas County are between that 55 and 64 age range, with a fairly even number of people between 35 and 44 and 45 and 54. We also know as a community that there is an increasing number of seniors experiencing homelessness. And while that is reflected in the pit report, one of the notes from the board of directors was that the PIT data did not capture that in quite the same way that we have seen over the last several months in our community. So I will be really interested to see what the 2025 PIT report has to say about the change in senior homelessness. And then here you can see the 2024 Pinellas PIT data unsheltered count as compared to other years all the way back to 2016. The PIT report does do a year-by-year comparison for 2016 to 2024, except for 2021. We did not do a PIT count in Pinellas County in 2021 due to COVID. But you can kind of see here, our numbers went down, started going down in 2022, remained relatively steady from 2022 to 2023, but we did see an uptick in 2024. And then here, I do have a live dashboard that I can switch over to, but I wanted at least everybody to see a screenshot of what the dashboard that will be on our website will look like moving forward. Thank you very much, Dapo. I'm not sure if you're on the call, but Dapo over Pinellas County did a great job helping us put this together. And I say helping us put this together, I mean, Dapo put this together and then sent it to me, and I'm very, very grateful for all of his hard work. But so I can share the live version of this as well. Give me just a moment to start that new screen share so that everybody can see this live. So once you go onto our website, not yet, it's not up there yet, but once you go onto our website moving forward soon, you'll be able to see this dashboard. And you can actually go here and you can filter, let's say, Clearwater, and you can see how many surveys were completed in Clearwater. You can see the adults, the number of veterans, the evictions in Pinellas County. You can see the race and ethnicity breakdown, the age distribution, and of course, the heat map is always available. You can also filter to see, for instance, veteran status. So if we just want to look at veterans, here we go. We're going to look at 57 individuals. That total household number is staying the same. We're going to look at 57 individuals. You can see the age distribution, the race and ethnicity distribution again. And again, you can still come here and see the heat map. So of course you can do sleep location, household composition. So are they adults? Do they have kids in the house? And then if you want to look by survey zone, you can do that as well. That might be very useful for the deployment subcommittee later on. Is there anything anybody would like me to click on specifically here before I move off of this? All right. Hearing no requests, I'll go ahead and I'll move back to that slideshow. Again, you will be able to access the dashboard soon, so don't worry. You will be able to access it and share it with your teams, share it with your advocacy groups, and use this in whatever way you think is best. And then as you are using this, as you are getting familiar with it, make notes and let us know what you think we can do to improve this moving forward. Oops, sorry, I accidentally just clicked on it. And that's a link. Give me a second. It's moving me over. Sorry, everybody. All right. That's what happens when you click links. All right. Now we have 2024 and 2023 PIT volunteer numbers. I thought that it was really important to see this. We deployed 395 volunteers last year. This is, as far as I know, a record. This was about 50 more volunteers than the year before. So congratulations to everybody who was involved in that process last year. I did provide a little breakdown of 2024 to 2023, so you can see how our volunteer numbers have remained consistent and changed over the years. For instance, last year we had more individuals from social services participating in PIT. So thank you all very, very much for that. We did see a drop in the Department of Veterans Affairs last year. I'm not sure what happened there, but that's an understandable drop. We also saw it in healthcare. So we'll just want to work a little bit more closely with those groups and see if we can get those numbers back up next year. Any questions about that? I'll check the chat as well because I haven't yet. No questions? Surprising. I feel like every time I do one of these, there are tons of questions, but that's okay. If you do have questions, if once the report comes out and you have questions, please don't hesitate to send those to me. Now, with all of that being said, Tony, are you available to talk about the duplicate or deduplicated data that the committee requested during our last meeting?
Yes, I do. Let me go ahead and share my screen. Oh, I can't share my screen. You have to give me the ability to do so. Oh, okay. Well, it seems that she's got it up, so that's perfect. So here is the data based on the request. So one of the requests from last week was how many people were duplicated in each zone. We also asked who the first responders were. So we've got those highlighted in blue. You can see the volunteer who did the duplicate survey and then what time that survey actually occurred. So as you can see, each grouping is separated out per zone. For just for some extra context, the morning duplicates counted total 7, and then in the afternoon, evening, there were 40 duplicates. The majority of the duplicates did happen in the Pinellas. All right, so is there any questions about the data that we're looking at? Is there anything that anyone wants to look at specifically with this information?
Yeah, hi, this is Dominique. So we had asked for, I don't fully understand honestly what I'm looking at. It looks like how many total were duplicated? Like from the duplication process, what was the initial number and it got down to the 721?
47 people were duplicated, or 47 interviews were duplicated.
So we only collected less than 775 surveys. Is that correct?
No, that's just for the duplicated people. There were other reasons that data was removed.
Okay.
So if a survey was removed because they didn't have enough UDE information that we couldn't locate them within HMIS, if the person was a category 2, they were also removed from the survey because we don't count category 2 on these. And I think those are the only two. Oh, if they did not complete enough of the survey to have any usable data, then that would also be removed.
So I think one thing this is, it's almost like a myth busting is what we've just done then with this, because you're saying only 47 were duplicated. And it looks like the most duplication was actually 6 this year, which is really low. Well, like so it's saying one person did 6 surveys?
No, that just means that there were 6 duplicated surveys in that zone. So what you're looking at is the number of duplicated surveys in that zone. So you can see in zone D1, only one person was duplicated. So one person did 2 surveys. Same thing in zone 2, D2, it would be 1 duplicated survey. So one person did 2 surveys. And so on.
So for example, like in that zone 6, we could say, because you look at the times, they're all over. So the same people are hanging out in the same area throughout the day. But in other areas where they're doing it, there's, well, maybe like S2 also kind of that same thing. Well, they're all kind of around the same time though. But some of the other areas aren't having people, the same people stay there as long.
The duplicated survey that was removed from this area. That doesn't necessarily mean that the original survey that actually got counted was from that area. We're just looking at the ones that were removed from that data. So that person that was in D1 could have actually taken the interview in their first interview that they actually counted in D2, and then their duplicate happened in D1. So all we're looking at is the surveys that were removed because of duplication.
Okay, so this is more relevant than to the deployment subcommittee that's looking at
Right.
the highest number of this one to, that's actually the whole time, but this S6, which I believe is the St. Vincent de Paul area, saw the most duplications, which was only at 6 for the day.
That other one that
Correct.
was S2, I think that's where that church was at. The parking lot.
UU
first-
Church.
Yeah.
Yeah, on this.
Was that the UU Church or the First United Methodist Church downtown, Dama?
It was the first one. So I don't know.
The UU? Okay.
It was the one that was right, the parking lot was right behind the Coliseum.
Okay. Okay. I think that's First United.
That's the Lutheran. Yeah,
That's the Lutheran. Okay.
yeah, to the east side of
Yes.
Coliseum.
Yep.
Yeah, that's the Lutheran one.
Good to know.
Yeah.
I also think that there is something to be gained from looking at this and what Tony said earlier about the reasons that surveys might be excluded outside of just being duplicates. I think that that is something for the training subcommittee to really consider this year, because we want to, I would think, work on training our volunteers a little bit better. We tell people, okay, they don't have to answer their age. Let's just keep going, their date of birth. But if we know that the survey will be excluded if we don't get their year of birth, then that's something that we should work on training the volunteers a little bit better on moving forward, I think.
Yeah, that's a good point. Every single UDE is required in order for us to be able to provide that information or use that survey for HUD report. So in a situation where we have a little bit of information, what we can do is we can go into HMIS and try to locate that person. So if they give us their first name and last name and birth date, we may be able to find them through HMIS. So there's not a specific UDE that you can say, this one is the most important. We need to make sure that we capture this particular UDE. Basically, all of the UDEs are equal. So the most information we can possibly get as far as identifying that person is what we want. So that.
And I believe we currently have those as because we're able to do the digital, those are required fields.
Correct. Well, I think they're all set for required fields, but I'm not.
And then there's also like for the date of birth, it's we really only need to know the age of the person, I believe, technically, according to HUD. But then we ask for full date of birth for deduplication. So I think that's kind of in the language of the question. Okay. Do you know by chance how many a single person completed, what the high one of the year was? Just curious.
No, I did not. I did not take a look to see
that's always
did
a
the
fun
most.
one to think about.
I can go ahead and take a look at that. I don't recall there being anything crazy this year. We didn't.
My opinion, even though it's broken out by zones, you're still looking at only 47. That's not a high amount of duplication. Maybe it would be relevant to look at some of those other determinations. Like what is done with any of the CAT2 data? Do we do anything with that? Is that part of a supplemental on a report or anything?
The CAT2 data is checked and it is given to Freeman in order for reporting. The CAT2 data is normally for couch surfing, or if the person said that they were in shelter, but we cannot verify that they were in the shelter, then we will count them as a client, a Category 1 client. So there are situations where people will say, I was in shelter. If we cannot back that up by finding the entry into that shelter for that night, then we'll consider the Category 1.
Okay. Any other questions as it relates to duplicates?
This is Megan. Can you hear me? Oh, sorry. I'm so sorry. Can you hear me now?
Yes,
We're
Megan, we
getting
can hear
this-
you.
The same
Okay.
feedback though, but.
I'm having computer issues, so
Oh, no, you're good now.
I see a duplicate for myself. I only did one survey. So in the training, the information in the app disappeared and I didn't know how to recover it or bring it back up. So I started a new survey.
So
Right. So that doesn't mean the duplicate doesn't mean that you did both surveys. That just means that
Oh,
you did
okay.
the second survey that was removed from that person.
Okay, I understand.
Okay.
I wasn't
Right.
sure. I just know we weren't, as a team, we weren't sure what to do in the app when that happened. So even if it's not related to this, it may be good training information.
I think in the app, there is a question for, did you do the survey earlier today? I think that might be the third or fourth question that we asked. So there is a question in there to put down whether or not the person did the survey.
Okay.
thank you all. Are there any now? Okay. Are there any other questions for Tony about this data? All right, Madam Chair.
All right, I said, sorry, moving on. We're gonna go into scheduling. So scheduling for point in time. So tentatively, we have the point in time scheduled for January 30th, Thursday. What say you? So what we've done in this, just as a FYI, HUD does require this to be done in the last 10 days of January, few exceptions mentioned like Tampa being able or Hillsborough able to do another day because of Gasparilla and some of that traffic. Other communities do it. Most communities do it on a Wednesday. Surveys can also be done over multiple times, multiple days, multiple areas, just all referencing the same night. So some communities do it 3 days in a row, 5 days in a row, asking where they were on one specific night. Where were you on Thursday night, Wednesday night, whatever that may be. It is not advised that we set up a hotline. It's really hard to track. That has been attempted in the past, I think even in our community many years ago. And you're just not getting good, reliable data that way, unfortunately. And then also you may complete surveys of people that you already are aware of. So whether you're checking in on your clients that you have in hotel or the residents that you're typically speaking with, you are able to count those for phone surveys, but not having like a tickler on the bottom of the news channel saying we're doing a survey today, call in to get surveyed. So any recommendations, comments, suggestions from the group?
Before we jump in for recommendations, I do want to let everybody know I did my best to look up some best practices from other communities. To be honest, I did not find a ton on date best practices. What I did find was that most communities are doing this over the course of either one day or 2 days, 2 consecutive days, and are not doing that, do pit over the course of a week type of thing, because we are always asking about that first night. So for instance, if we did pit from the 25th through the 30th, even on the 30th, we would have to be asking folks where they slept on the night of the 25th, which is kind of hard for some people to remember. I don't know about y'all, but I have a hard time remembering what I ate 5 days ago. So I don't want to hold people, I struggle to hold people to that standard when I know that I struggle to achieve it. But that is really what I found, other than, again, that most communities do this on Wednesdays. Communities who split the shifts do seem to do them mostly in the daytime. There wasn't a ton of evening work that I found there. But but that is what I found from my research.
I think some of the concerns I'd have, unless there's like data that really shows a huge benefit by changing that, then we're risking, now we don't have comparative data from year to year, like whether it's on location or, you know, splitting up the days and things like that. So I guess that would be my big concern.
My thought would be is to keep it at 1 day. My only add-on would be if there was a special targeted meal site or something that's happening the following day that we could put further support at, if that makes sense. I don't know if anyone that, so say we keep it on Thursday, of anyone that is doing a meal site or location on Friday. Like, let's use the UU Church as an example. Their Friday night dinner might be another opportunity that we would support in addition to the full day Thursday.
I see Tony's got his hand up.
Yes, I just want to make sure that I have this correct. So that date, the PIT date, is the date that we actually do the survey, not the date that we're looking at. So we would do Wednesday, January 29th at midnight is the date we're actually looking at, and then Thursday would be the date we conduct the survey. Correct?
Yeah, so the survey is that when the survey is always about the night before. So if we do Thursday, January 20th, when we go out on Thursday, Thursday, January 30th, when we go out on Thursday, January 30th, we would be asking people where they slept the night before. So that would be the evening of January 29th into the morning of January 30th.
Understood. Thank you.
I know we have some different street outreach people on here. Does it make sense to ask them like who we're missing on that day? Like people that they may run into out in the community during the week on a normal basis that they don't think are captured typically in PIT.
Absolutely. Without putting any of our street outreach folks on the spot by name, are there any street outreach folks that would like to give some insight to what Ara just asked there? All right. So I won't call people out by name right now, but moving forward, I am going to maybe start, as we're doing virtual meetings, start saying people's names, and I want to see like emojis or reactions or something in the chat just to make sure everybody's paying attention. Because I know that Dama and Dominique and Arrow and Tony are here, but is everybody else with us?
I am, and I did try to unmute it to respond.
Thanks, Kathy.
In Clearwater, I mean, for some reason, this last point in time count, the ones that would usually be at the meal sites weren't out, and they knew well in advance how important it is to do the point in time count. So, but, you know, it's always sporadic because we may see them for weeks on end, and then they're AWOL for months on end. So, because they're transient and they go places, or they find that really good hiding spot somewhere, that they can stay. They found that place and they think that they're safe for a while until a rain comes or someone else finds them or something. So I don't know that going out a couple days would really make a difference.
Thank you, Kathy, for that feedback.
Hey, Victoria, Dominique, it's Sarah from
Hey, Sarah.
Cafeteria. The only thing that I can say is Hillsborough, we do technically split it into 2 days. We do our overall giant count on that Thursday in February because of Gasparilla, but then that Saturday is when we do our youth count. But I will say it's always a struggle to get the additional folks to show up and to get those surveys done. The way that we have sort of, I don't know how to phrase it, combated that has been bringing things like barbers and hairdressers who are willing to give, their services and big meal options, food trucks and those kind of things, and working with our YAB now that that's established, to create what their needs are, like really truly listening to them and what they need. Because like Kathy said, you do have a lot of folks, you talk to them for months and months, and then, you know, they disappear a lot of times, at least in my experience. And I think will increase even more so come October 1 is being institutionalized, whether that be arrested, hospitalized, Baker acted in long-term stay, whatever the case may be. But we are going to see a very large increase in that, based on new law and policy. So this year is also going to look even more unique, I think, for this. And we're going to have to get really creative about street outreach and interaction prior to the pit count, and not just to our sponsors, not just to our volunteers, but truly to those people who really need to be counted so that we do get this funding from HUD. Because I'll remind everybody, that is exactly how that works. If they don't think your community has the need, they are going to give their dollars elsewhere. And we know that it is a need in our community. And in order for us to continue to get those big dollars from feds, it all comes down to these things. But I will say my personal opinion is splitting it to 2 days is more of a detriment than adding to success, because then you're remobilizing more volunteers and more sponsors and more time and all those things that are kind of precious to people these days. So that's my 2 cents.
Those were
Thank you,
valuable 2
Sarah.
cents, Sarah. Thank you.
All right, so let me break this down first. Is anyone opposed to us keeping the Thursday, January 31st date? Okay, Victoria, do you need a
No.
formal motion to keep it on that day, like for all of this, or no?
We
Seeing as
do.
she had shake no.
We
Okay.
do not. We don't need a formal motion for that.
Okay.
My next question, and this could kind of be determined later on, that doesn't necessarily need to be right now, but do we want to keep doing the 6 a.m., 9 a.m., 1 p.m., and 4 p.m. shifts that had been done previously? Or do we want to look at altering that a little bit?
Yeah, this is Nate from Ready for Life. So I wanted to know, do you still want us to do just our normal times that we normally do, the 9 a.m. to 5 p.m., or do you want us to go to 7 p.m. on that Thursday?
Thank you very much for being here, Nate. So this year, we, during our last meeting, decided to move away from the youth events that we were kind of trying to build up over the last couple of years and work on integrating youth outreach more into the primary survey. So I do think that we will still want Ready for Life, probably because you've been doing it for years and people know that you're there. We do probably still want some folks to be available on site for surveys there around that same time. But we'll also want to look at the youth outreach subcommittee should look at best hours and best locations and whatnot for completing field surveys with youth this year.
Okay, so but are we so is Ready for Life not a pit stop this year? Is that what we're saying?
So we are moving away from the drop-in locations for youth this year, but I do think, and this will probably be something that needs to be ironed out a little bit more as we move forward. But I do think that because Ready for Life has been a drop-in location for so many years, it would be good if people could still come in and complete a survey on site, but that will not be the primary focus for youth this year.
Gotcha. Okay, now for my next question, I had another question too. Was are we still trying to do that Friday as well, just in case we have backups that come in on Friday that might be a part of the pit count?
So for youth surveys, over the last few years, we have been doing phone surveys and whatnot on the Fridays. For everybody who doesn't know, that is, as I've said before, we do phone surveys for youth and for families that are on the shelter wait list, and we do that the day after PIT. We've been doing that for a few years now, just to make sure that we are capturing the information for those folks who maybe didn't complete a survey the day before. And so that is definitely something that we still want to do for our youth and our families this year. As far as walk-in surveys on that Friday for youth, Madam Chair, do you have thoughts?
I don't necessarily have any specific thoughts, I mean, or decisions, but I think if we are doing it for a specific population, I don't know why we wouldn't be doing it. I can see the pros and cons to it, I'll say that. How about that? And that's the same thing as it applies to, like you said, families, but also, you know, individual seniors, like where do we decide? I don't know what the overall group census is. That was part of the specific efforts of the youth pit. And then the family one was, I think, because we identified the gap of those families not necessarily being contacted or in the public and being captured during the point in time, but being aware that they were there. So if there's an expectation that like all providers with clients are making connection, like that's a much bigger question. I don't know if that's something we want to have here or offline, what your thoughts are.
Didn't we have Operation PAR do that as well this past year? I thought there were another one that kind of got on the reaching out with their clients there.
I don't think that they did. Blossom had a team member at the VA doing walk-in surveys. Family Resources and Ready for Life did drop-in surveys. And then the HLA team called the families on the shelter wait list. But I don't remember Operation PAR doing drop-ins or phone surveys last year. It is worth noting, Todd Nut Brown said in the chat, I have worked in other areas in the US and we have tried different timeframes, and the timeframes we used last year seem to be the most effective implementation. Thank you for that feedback, Todd. Okay.
I say we keep the same. I only the same time chunks. My hope was actually to eliminate like the 1 to 4 or 5 to 7, but the duplication data that was presented doesn't necessarily support that. So if there's anyone else who disagrees with that, I was under the assumption the afternoon would have more duplicates, and it does have a couple, but it's not a significant amount in my opinion.
So back to my original question, we'll still be getting a count from our youth, but we just won't be a drop-in location for that pit count, correct?
You will not be an advertised drop-in, if that makes sense. So
But if we do have people that
can
come in on
still,
that day, we'll still count them out on that pit count?
yes,
Okay.
I would encourage someone to be, you know, trained and ready to do those surveys as people are coming in for
Yeah, so
survey.
me and Falana have done it for years, like Victoria knows, and then Jake's been here too the last year, I think. So we can at least do the surveys here, but we won't need like volunteers outside of Ready for Life staff other than me, Falana, and Mr. Jake to kind of just do youth pit survey when they come in on that day, if that makes sense.
Absolutely.
Okay. All right, thank you.
Thank you. All right, so based off the feedback we've collected, we're going to stay with Thursday the 30th. We're going to keep our 4 time chunks. There'll be follow-up on Friday with families still. Did we want to, any thoughts on having like specific, if there's a specific Friday outreach, like the Friday evening meal at UU or another location, would those be relevant to the group? Should we include that as part of the point in time efforts?
Could just be making sure that it's not going to be a place where we're going to get a lot of duplicates from the day before. So one of the things I was thinking of too is where's the mobile medical unit going, like, or the one that goes the other mental health, or the van that goes into more like the encampment areas and stuff like that, like maybe trying to catch some of the people or make those connections enough that they'll open up where they're otherwise saying no, they don't want to fill out the survey.
Yeah, the Salvation Armies where they're typically out on Friday, so they'd be captured through that data. And then I don't know what the street med van would look like at that point, but they're going to be trained to do surveys as they do their regular service delivery for that Thursday. So somebody would be trained to conduct surveys, but they would do their normal job.
On that note, Megan Jetter had said in the chat, if it is one day, can we have drop-in surveys available throughout the county? The housing authorities may be a good place to have them. And I had responded in the chat with proper planning, partnerships, and staffing. We could definitely create more opportunities for people to stop by housing authorities, libraries, and resource centers to complete a survey. So not the big youth events that we did last year where we had, you know, hairdressers and food and all that kind of stuff, but just in the regular course of their day, stop by the library, stop by the housing authority, complete a survey, and that kind of thing.
You said local library when one of those stops, correct?
So previously, in years past, we have deployed volunteers to the libraries. We can do that again this year. We can also work with some of the libraries to try and have some of their team members available for surveys as well throughout the day.
Okay. I know that Largo Library gets a lot of some of those youth as well as just regular homeless youth and people that are out there as well. So
Excellent, excellent. Definitely something to consider. So my thought is if we're keeping these same shifts, DAMA, deployment center managers and the deployment center subcommittee, it would probably be a good idea to consider the number of volunteers that we really need for these shifts. Do we need the most volunteers at 6 a.m.? Do we need the most volunteers at 1 p.m.? So I think that would be something to look at and consider this year. Do we have anything else for date and time, Madam Chair?
Nope, I think we are ready to move forward. Thank you.
All right.
The fun paper versus digital survey discussion. So next we have the digital surveys, I think, have really helped us get some better, some different data, I'll say it that way. It's been able to get us heat map. It's been able to improve our data entry. Having some of those fields be required also has helped that, and obviously reducing paper waste. I think at one point, almost 2,500 sheets of paper were being used, provided by the city of St. Pete. Thank you for that. And so we have tried to, the paper surveys that have served as backup, those get entered in. We've been doing those at deployment locations mostly. So if there is a paper backup, it is being entered back in once they get back to the deployment site. The question is, should we continue doing paper surveys? And if so, are there any thoughts on how many? And I'll just go ahead and say that I personally think we should still need a small number of paper surveys, but I think the numbers should continue to be greatly reduced. Also, the deployment locations, understanding the expectation that if all systems do go down, there the ability to print and get these done for the shifts to be able to distribute out. Thoughts?
I agree. You do still need some paper, but again, I mean, it for St. Pete, we really didn't have that many paper come back.
So last year we did approximately 3 surveys and 1 supplemental survey, printed paper. We gave every team that. So every single team that went out got 3 paper surveys and 1 supplemental survey. Would it make sense to reduce that to 2 in 1 or 1 in 1?
So I think that the issue is usually because we have those 2 back-to-back shifts, the 6 to 9, 9 to 12. After that, it's fine because we get them all back. But when you're trying to get stuff ready for the 9 to 12, that's the conundrum. So I don't know if it makes sense. I mean, because you have other people there too. If something happens that like your tablet's not working or whatever, that you could, or your phone or whatever, that you could have someone else in your group do that survey. But I don't know, maybe in just the bigger areas, like where a slowdown like that would really cut, like everyone's going to be busy doing surveys. And, you know, if there's a slowdown with technology, that it would hinder the amount done or something.
since we've moved to digital surveys, what has been the number of paper surveys that have come in, and how many instances of technology fail have we had?
I don't have an exact number of instances of technology fail,
Mhm.
but I can tell you it has happened. It tends to be rare. And like Arrow said, we do have teams out there. So there's usually not everybody on the team is completing a survey at the same time. And if they are, usually the team leader isn't completing a survey at the same time. So there
Yeah.
usually is an extra device somewhere in the group.
That's been my experience. I've actually never been on a team where we were all doing one at one time. I know it happens. I just have not experienced it. I've been in lower levels too. So, but the reason I ask is when you said one-to-one, in my head, that makes sense. But if it's not going to be enough, or we're going to create, we're going to cut our nose off to spite our face, then it's not really worth the saving of the paper, is it? Like, I think definitely it's easier to use the digital one. And it works better than paper surveys and trying to collect them and not have them blow away on you and so on and so forth, because been there, done that. But I think the digital is just better, and I think one-to-one makes more sense, but I don't want to say that. And there have been a ton of need in the last year or two since we've gone digital for the paper. That's why I thought that might be a good question.
Thank you for asking. And yeah, the number of paper surveys that have been done, I would say that there are, and Dama, please correct me if you think that I am wrong about this. Dominique, you would know as well. I would say that there are probably less than 30 paper surveys coming into each deployment center. So less than 100, I would say, throughout the whole day, when we do somewhere around 1,200 surveys.
So then one-to-one for one supplemental and one, that seems like it would cover our bases for the numerics that we've been experiencing anyway, and cut down on some of the paper waste, because then if they come back to us blank, we're just destroying them, right? Yeah. So yeah.
We do keep them year after year. So if, for instance, we made no changes to the survey between last year and this year, we will reuse last year's paper surveys,
Okay.
but that doesn't usually happen. Usually there's
That
an
never
update.
happens,
Hasn't happened yet. We thought we were being smart 2 years ago, and we said, "Oh, let's take off the year. We'll do a version," and then we've changed it every year anyway. But I'm good with moving to the one-to-one. I mean, yes, there is technology issues both years that we've done it, and they're like kind of one-offs, or they've been kind of user error. And I'm thinking specifically of people I've been deployed with, where I knew that their access was not going to be the same way that I access the app, right? So I don't know if we want to potentially, we continue to push out using the app, but if we identify people that are preferring the paper, do we still give that as an option? Are we really pushing people to only use the app?
Yes, I think we should.
I think we just push the app personally.
Okay.
The app
push
was
the app.
Yeah.
And so push the app, and then we're going to have one for the surveys for team leads with their map as backup.
Yeah.
Dominique, just to kind of just throw some information out there, just in regards to the paper surveys. I know when we did the point in time last year, we had code enforcement help out, and there was probably about, I would say, 7 to 9 of them as our survey takers, and they were unable to use the surveys on their phones and could only use the paper survey. Something with the Pinellas County security feature on their phone.
Well, that was the app was from Pinellas County, so they probably just didn't go through the right avenue, because I also have a county ArcGIS account and had a point in time ArcGIS account, but that could be true for law enforcement, or actually no, they have ArcGIS too. So I don't know who all that would apply to, that we might not be able to troubleshoot.
So what
Okay.
we did, Dominique, and I haven't done that with ours in a while, but on apps that we need pushed out to like everyone, our IT, if they're city issued devices, IT is able to actually push those apps out onto their devices for them. So it might be just reaching out to make sure, like, if you want all county issued devices to have that app on there.
Which is the VA on here? Because they did have an issue with that scenario, and because it's it's not local government, it took a while to get approval. I don't know if they actually got, does anybody remember working with a VA staff person this past year, if they used?
Yes, Blossom. This is Blossom.
Oh, hi, Blossom.
It took us nearly a year to get approval for use. And then we got approval on the old system. And then I know you guys used a different application this year. So I just kind of let people know that I was training. If you want, you have to use your personal device. And no one really had an issue with that and did that. I don't really know of any VA persons that used a paper copy. And we did suggest, maybe being a team lead, we made other suggestions to VA people if they weren't comfortable using their personal device. But on a VA device, we are not approved on the new application, just the old one.
Okay.
And we had to get it through, like, I don't know if this is helpful to any other agency having an issue, but we had to go like all the way up through our privacy offices and our security offices at VA.
Well, what I'll say is if you want to try this one, you can, because it is already kind of vetted by a lot of those county federal government entities. So this one might be an easier ask.
Okay.
It's the one we used this past year as well. But I
So
know
it's probably here to stick around.
I can also,
Um,
Blossom, I can provide some information on the app if it's helpful. The app that we're using now was actually created in conjunction with the U.S. Department of Housing and Urban Development. So this is something that the federal government has had their hands on. So that might be a bit of a help, and I'm happy to provide information if that's helpful.
Yeah, we definitely, I know the first time, Victoria, we had to reach out to you often to get, different literature. And so, yes, if we need items from you, I'll get with Yvonne and I'll let you know.
Perfect. Sounds good.
All right, sorry, I was muted. So I think we're going to move forward with the one-to-one, and we're going to see maybe potentially what providers will not be able to have access. Subcommittee planning, moving right along. So I'm just going to do a high-level overview again of some of the some of the subcommittees. Hopefully you guys have all taken the surveys on those to be a part of those. The deployment committee, and please fill me in if I'm wrong on any of these items. The deployment committee, is looking at the zoned areas. They are going to be, that's going to be led by Dama, and I think also Michelle Hansen's helping out with that one, and helps to plan the volunteer schedule, but not actually the volunteer assignments. So they're going to be working on creating that survey map, identifying hotspots and engaging with other providers to make sure those deployment zones are set. Then we have, Victoria, you already have a list of a lot of these. What are you going to be sending out another follow-up, or what is the ask on these committees?
Yeah, so my ask is really that people get involved in the subcommittees, that the subcommittees start meeting this month. So if as Dominique goes through and gives a brief overview, if you want to get involved in one of these subcommittees, please do. The ask is that everybody who's part of the committee get involved in a subcommittee, because that is really where the bulk of the work is done. So please join at least one of them. And we also need leadership still for a few of them. So please join in. And if you have any questions, now is a great opportunity to ask them.
All right, so deployment, we're done. First responder subcommittee. This is something new we tried to start last year with law enforcement and fire. I was able to get on the fire agenda, and then they canceled most of their holiday meetings, so we were not able to engage with them like we wanted to for this past year. Obviously, there's also some legislation, anti-camping legislation that's coming out, and how that will impact point in time in general. And how we respond and deploy for that. But that is a subcommittee we have. So if you have any relationships, interest, partnerships with this community, or are part of that community and are interested in serving as part of that subcommittee, that would be great, greatly appreciated. Have we been able to secure the trainer for this year for law enforcement, Victoria?
I have not reached out to Lieutenant Haish about that for this year. But is Lieutenant Haish, are you on with us right now? He does not appear to be. But hopefully we can get somebody to chair this first responder subcommittee and decide about that. Otherwise, I will get with Lieutenant Haish and figure it out.
Does anyone have any interest in this? Please put in your information in the comment or unmute yourself at any point. All right, next we have the marketing committee. I believe last month we identified some people that were interested in the committee and potentially still looking for a chair for this committee, but ideally recruiting volunteers and partners, working on some of the marketing tools. There's already sort of a toolkit that's been in use for the past couple of years. So updating that and helping get some of that information out as we get closer for recruitment, volunteer recruitment, as well as deployment and surveys, letting residents know too. Next, we have survey development, which I think I might be the chair of that. I might be the head of this one, which is working on creating the point in time survey, ensuring high compliance. My hope, to be transparent, is to, I think it was Lieutenant Haish who mentioned, like, how long does this survey actually take? How many questions do we actually have? We've continued to add questions, I think, every year, but not necessarily take away any. So my hope is actually to kind of flip this survey upside down, if that motivates anybody to join me. I see a thumbs up from Arrow. I don't know if that's to what I said, but so if anybody wants to join the subcommittee for survey development, that is my plan. I also have been working with the digital survey development, making sure those translate to each other the past couple of years. So I'll continue to do that. Next, we have the training subcommittee, which I know we absolutely need a chair for this. Victoria Kelly has graciously taken that on the past couple of years. I know she's ready to pass that torch, but creating the curriculum and materials, again, there's already a good foundation. Unless I completely am able to flip the survey, then we'll have to update that curriculum. And then recruit and train trainers. So we're looking for trainers too. I know there's a couple of us, including myself, who said I will be a trainer if you're willing to do that. If you're willing to be part of the training subcommittee or even lead the subcommittee, we're still looking for that. Because we're meeting digitally, my hope in general is that like after the next meeting, we're going to get a call out, like, how was your meeting? What have you all been able to do as part of your subcommittee? But also potentially break out into small groups, so you're actually able to have committee meeting immediately following the larger meeting as time allows. So just something to think about, that might be easier to break out into small groups following next month's meeting to meet some of those subcommittee needs. Next, we have Youth Outreach Committee. So we talked a little bit about this earlier, but last month we decided to transition this from a youth activity to an outreach. So it's more about getting the information out specifically to our unaccompanied youth, which is our 18 to 24, and individuals in the community, and making sure that they're aware of the survey. So it kind of works in tandem with the marketing committee, but also with a targeted specific population. So do we have a chair this time for that one? Is that?
We do not as of right now.
All right, so we still need a chair for that as well. Remember Victoria's ask, and all of our ask is that everyone would be involved in some or many multiple subcommittees. So we are still needing people for a number of these committees. Are there any questions about some of the committees we talked about or some of the roles that we could talk through together? Or maybe you want to recruit somebody or volunteer somebody? No, I'm just kidding.
This is Sam. I had a question. If there isn't a chair for a specific subcommittee, what happens? Like, do we get a list of who's supposed to be on it, or how does that work?
Howdy. I happen, Sam. If there is no chair, HLA will step into the role to make sure that the subcommittee's meetings go forward. But that's not the goal. Y'all don't want us to be leading all the subcommittees, because this is very much a group effort. And these questions and this data, it's important to what we all do. So please jump on in and get involved and pick a subcommittee. There is a list in the meeting agenda packet of everybody, all of the PIT meeting participants, and your requested or suggested subcommittees. You might notice next to your name there is a red subcommittee. That's because you have not specifically requested any subcommittee, and I just thought that might be a good fit for you. So please check that out and look for your name and check out the subcommittee you have requested or has been suggested for you, and reach out to me or reach out to Dominique and let us know your thoughts.
All right, thank you. Next, we're going to move into the timeline. So it will be here before you know it, but we are 21 weeks away. I love that little clock. It cracks me up. All right, so we are 21 weeks away. We've already met for August. September, we're hoping before, I'd say by the next meeting that something is scheduled or has already happened. I think it depends on the committee, to be honest, but that we have something on the books or has already met at least one time before that September meeting. Our recruitment will begin as early as October 1st for that January 30th deployment. November, we're looking at finalizing most of our committees and starting to get that information out. So the frequency of meetings for those subcommittees will vary, also depending on the committee, but as we get closer. December is when we really get into the grind of it, of making sure that we have finalized the surveys and worked on translation. We had English and Spanish in 2023, excuse me, but we were not able to do it for 24. So we're hoping to bring back the Spanish into the digital form would be ideal. The third most common language in Pinellas County, I believe, is Thai. So I don't know if we're going to be doing any additional languages, but there has not been Spanish language surveys completed in the past, to my understanding, to my knowledge, except for many years ago, post-Hurricane Maria. So deployment zones will be finalized, training, registration, digital surveys, all of that good stuff, as well as the youth point in time, starting to get that messaging out in December. Which leads us into January, which is when we are going to start our volunteer training 2 weeks prior to the PIT, get that registration out, volunteer set up. You guys have this information, but the January 30th is finalized. We're moving forward with that date and batching the supplies on that Monday before to get those to our deployment zones. And then it is go time on January 30th. Some of the wrap up, we did this the last couple of years, is having our wrap up pretty quickly following in February, March. So in February, we'll have a debrief and kind of celebration. We'll move also into collecting, HLA will work on collecting and deduplicating that information. In April, they have to submit it to HUD as part of the HIC, the housing inventory count, which is also the bed accounts in our community. They're gonna contract with a point in time author to make sure we're able to get that, and then I'll hopefully get the point in time report in the summertime to the board of directors and out into the community. This wasn't on the agenda, but I did have a discussion, so open discussion, look at that. Is there any way that we can move up this point in time report and that timeline? Part of my understanding is that part of the reason it was delayed or it came out in like July was because of the school data, but that has been clarified this year that the school data is still coming from January. So I'm kind of curious why it takes so long for that analysis and all of that to come out with July, and then now we're getting edits, so we're looking at now September, and we that's still not been released until Friday.
So that is a great question, and is definitely on my goal for 2025 to get that out sooner. What has happened the last few years is that the report is completed in June and presented to the board of directors in early July. Unfortunately, this year, the board had to postpone their July meeting to August, and then identified a couple of updates that they wanted made to the report. So we have had some unforeseen delays this year. My goal for next year, though, is to get this to the board of directors sooner and move that whole timeline upward. And definitely not to have it released in September. That is later than other years and is not the intention. So absolutely, definitely our goal for 2025.
Are you putting it out competitively for the report author, or is that going to be the same? Do you know?
We are planning, if he will work with us again, we are planning to use the same author again next year. The delays are not on him. That's not a function of his.
I'm just wondering what the timeline would be like. Does he think it's feasible? Because I understand April, that's when like the deduplication and all of that's when it's going to be submitted to HUD. So you wouldn't necessarily want him to get data before that time, because could be some other deduplication or something that happens. But how long does he like physically need to dive into that report and analyze, and get what you all need, what our community needs as a report? So like, is June feasible with an April submission and then getting it to him? That's what I'm trying to figure out. Do we know how long it takes him to do that analysis that he does?
So I can get a more exact timeline from him instead of here's what we want, here's what can you do. We can definitely work on that with him. We do have to plan around the COC board of directors meeting schedules for the presentations, but that is probably we're probably not going to do a July meeting next year by the sounds of it. So we'll see how that date goes. So my answer is I will get more information and circle back because I can't answer every question right now. But
I know that I'm just, when I ask questions, that's kind of what I'm thinking through, right? I'm not asking for an answer or a solution.
Of
but
course.
Moving that timeline up, can that feasibly be done, and can we get something to support that?
Yeah, that's definitely something that we can reach out to if Freeman is going to be our report researcher and author again next year, which I hope he is, or that we can put into the request for proposals. Absolutely. Oh, Freeman's on the line with us right now, and he says, yes, it is absolutely feasible to get it done sooner. Thank you, Freeman.
Yay, Freeman. I'm like 2 weeks, 4 weeks. No, I'm just kidding. But that's part of that. Yeah. And I know you also work at a school, so at a college. So you're looking at graduation and all that timeline too. So appreciate it.
Thank you very much, Freeman.
Any other open discussion?
Just on that level, just wondering, so the data gets submitted in April to HUD, and I recall the report this year too had like recommendations for the system. And I'm wondering if that's the reason why the COC board has to like vote to accept the report, because I know that was the big holdup, like they want to make sure they understood everything before they accepted what they were saying as the recommendations, like to move forward. Just wondering if instead of recommendations for the system, it would just be kind of, I think he's already got at the beginning of the report, kind of like the key findings from that year's data, because it seems odd to have, one's like an analysis, but it really is like the system would be providing what the recommendations are at some point to the COC board based on those findings, I guess.
That is a great question, Arrow. And for anybody who hasn't seen the report yet or one of the past reports, one of the things that is included year after year are recommendations from the author. Freeman, as he did in years prior, included, I believe, 6 recommendations in this year's as well. They include things like advocating for affordable housing, things like that. Trying to increase the number of medical respite beds. So you'll see that when you look at the report if you haven't already. But to answer your question, Arrow, the recommendations are certainly part of why the board has to review it, but they are not the only reason. So amending that recommendation section would not remove the requirement to go to the board of directors first. The entire report and analysis must be approved by the board before it can be released publicly. Great question, though. We are, so that everybody knows, one of the things that the board has asked for next year is before the report goes to the entire board of directors to do a PIT report work group so that the board has an opportunity to really dive into the PIT report before it is presented so that there is hopefully less of a delay between presentation and release next year. I hope that answered your question, Arrow. Anyone else? Thoughts, questions, concerns, really exciting things you want to share with the group?
All right. Hearing none, can I get a motion to adjourn? Because I can't do it.
Motion to adjourn.
All right. Thank you, Dama.
Second.
And Arrow coming through again. All right. Thank you, everyone, for coming. I hope you have a great rest of your day.
Thank you.
Thank you.
Bye.
Thank you, everybody.
Thank you all so much.
Thanks, everyone.
Please reach out if you have any questions about subcommittees. Thank you all.
Bye.